Hello, my name is Samina and today I will be talking to you about BOTOX. We have all heard about it, but what exactly is BOTOX? BOTOX is a drug made from a purified form of a neurotoxin produced by the bacteria Clostridium botulinum. The toxin is called botulinum toxin and is known to cause a rare form of food poisoning called botulism, in which ingestion of contaminated food causes paralysis and, if left untreated, may result in respiratory failure and death. So despite the botulinum toxin being so life-threatening and costly, it is in huge demand. The reason behind this is because when injected in small doses, it relaxes the muscles, or it is muscle relaxant. Many different types of botulinum toxin have been identified. However, types A and B are the ones that are used commercially. It is sold under names like Dysport, Xeomin, Myoblock, as you can see in this picture. BOTOX is commonly used cosmetically to remove wrinkles and frown lines by relaxing the muscles of the face. Here is a before and after picture of a woman who has received the BOTOX treatment for the wrinkles around her eyes. Other than cosmetic, it is also widely used medically to treat over 20 medical conditions, some of which include chronic migraine, strabismus, hyperhidrosis, cervical dystonia, blepharospasm, sialorrhea, and overactive bladder. As you can see, most of these conditions are muscular conditions which are also associated with multiple sclerosis. So BOTOX is used to treat these symptoms, and I will be talking more on that in the upcoming slides. But first, how does the botulinum toxin in BOTOX work? Botulinum toxin invades the nerve cells where it releases an enzyme that binds to specific sites on proteins in the nerve cells. This protein-enzyme complex blocks the release of acetylcholine into the neuromuscular junction. As we all know, acetylcholine is a neurotransmitter that activates the muscles. In its absence, muscle contraction cannot occur due to the chemical denervation, so the muscles are at constant state of relaxation. In this normal synapse, acetylcholine is released into the neuromuscular junction through the impulse in a neuron, causing muscle contraction. In this BOTOX injected synapse, however, the release of acetylcholine is inhibited, so there is no muscle contraction. As I mentioned earlier, BOTOX, or botulinum toxin, is used in treatments of many symptoms associated with multiple sclerosis. This BOTOX treatment for multiple sclerosis became really prevalent about 4 years ago. In brief, multiple sclerosis is an autoimmune disorder in which the nerve cells are damaged, causing the nerve signals to be out of sync. This makes the muscles tense up and move involuntarily, causing random muscle spasms, especially in the upper and lower limb. The botulinum toxin in BOTOX blocks acetylcholine, as I mentioned earlier, allowing the muscles to relax and therefore decreasing muscle spasms. This is why it is used to treat the symptoms associated with multiple sclerosis, like painful spasms in the arms and legs. This treatment decreases the pain and improves mobility to help with day-to-day activities in the multiple sclerosis patients. It can be injected into individual muscles to prevent the nerve messages that cause spasticity and spasms. It can also be used to treat overactive bladder symptoms, when spasms in the muscle of the bladder cause urgency and incontinence, which can be very inconvenient for multiple sclerosis patients. Some patients with multiple sclerosis also develop problems with their vocal cords called dysphonia. Very small amounts of BOTOX is injected into the vocal cords to treat this condition. BOTOX may be especially beneficial to the multiple sclerosis patients in situations in which patients have difficulty tolerating oral antispasticity medications due to the side effects. Here I have prepared a slide on how BOTOX is used or how it is registered. So BOTOX is administered by diluting it with sodium chloride and injecting it directly into the neuromuscular tissue using a thin needle as shown in this picture. It takes anywhere from 24 to 72 hours for botulinum toxin to take effect, which reflects the time needed for the toxin to disrupt the synaptosomal processes. Sometimes it may take up to 5 days for the full effect of the BOTOX to be observable. The effect of the BOTOX lasts for anywhere from 2 to 6 months until the muscle develops new receptors and is able to contract again. So, in summary, BOTOX is a drug obtained from the bacteria Clostridium botulinum. It is used commercially for getting rid of wrinkles and fine lines. It is also used medically, which is the most important use for treating muscular conditions, especially the ones associated with multiple sclerosis. It works by blocking the release of acetylcholine into the neuromuscular junction, therefore inhibiting muscle contraction. It is registered using a thin needle directly into the neuromuscular tissue, and it takes anywhere from 24 hours to 5 days to see the full effect of the botulinum toxin, and it lasts from 2 to 6 months, after which you have to go back and get the treatment again. Here are the references for the images that I used in this presentation. Thank you.